sharing. I'm so sorry I haven't been live for so long, but of course, life happens. I'm sure you can understand. But I'm doing this live today to discuss and talk about pelvic floor exercises to help make you aware, make women aware if you're pregnant or you've just had a baby or you are planning to get pregnant. This exercise is a must know, and you must be doing them. You must be remembering to do them, and also spread the word to anybody that you know, any woman that you know, to also do pelvic floor exercises. Okay, it is so important that you are doing your pelvic floor exercises during your pregnancy and after your pregnancy as well. When you are pregnant, your pelvic floor muscle is going to be a big major part of your pregnancy. It's going to be holding the weight of your baby, the weight of water, placenta, and is going to, of course, help you to deliver your baby. So all of this can take a toll on your pelvic floor muscle, especially if you've never done exercises before, if you didn't even know about it, and if you were not told about it, or you were told, but you didn't really take it serious, you didn't do anything different, you just carry on with your pregnancy. Of course, there's loads of other things you're doing anyway during pregnancy. So it's understandable that this will go amiss. Okay. But I'm here to remind you and tell you about your pelvic floor exercises, the importance of it. It is so important that you're doing your pelvic floor exercises. You cannot go through your whole pregnancy without doing pelvic floor exercises because you're going to do damage to this area. And what that is going to cost you is just not worth it. Okay. Do you know when people are pregnant, they will end up with any issues with incontinence? They will end up with issues like leakages. They will end up with problems like not feeling the urge to pee, or peeing and where it doesn't finish, or they don't feel like it's completely emptied, and or they finish passing urine, or so they think they finish, and then when they try to get up, they trickle. Okay. And then they think, oh, it's because I've had a baby. Oh, it's because I'm pregnant. Guys, this is not normal. It shouldn't be part of your pregnancy sort of journey. You should not be accepting it. There is something that you can do, and the thing that you can do is called your pelvic floor exercises. It is so important that you are doing your pelvic floor exercise, whether pregnant or not. If you're a woman, you need to be doing pelvic floor exercises, okay? Please make sure you know how to do it properly, and you are trying to tag it or try and do it in combination with doing something, just so that your memory or your mind will remind you that you need to do your pelvic floor exercises. If you are pregnant, your pelvic floor muscle is going to be a major part of your body and your whole structure of your pregnancy. Your whole pelvis is part of your pelvic floor muscle. Where your baby is sitting in is where your muscle is. And if you do not exercise it, you are going to have issues. These are the problems you're going to start to face if your pelvic floor muscle is weak. Okay, so let's say you've already had your babies, you are done with having children even, but you have issues such as going to the toilet and you feel like you haven't emptied your bladder, or you think you finished passing urine and then when you stand up you pee a little bit. That means you've got a weak bladder. Let's say you're laughing, you're watching something funny, and then you start to laugh, and all of a sudden you laugh so hard you pass urine. That is a weak weak pelvic floor muscle. Let's say you are jumping around, you're running, and then you feel like, oh, I'm peeing a little bit. That's a weak pelvic floor muscle. This may have come from children or childbirth or even pregnancy. People think that just because if you're going to have a cesarean section, you don't need to exercise your pelvic floor muscle. That's not the case. Even without having a vaginal birth, you can still experience pelvic floor muscle weakness. Okay, because just for the sheer weight of your baby is going to give you a little bit of the stability of your pelvic floor muscle is going to be affected, because babies are heavy. Laying on your pelvis for a good, by the time your baby gets heavy, you're around about maybe 32 weeks up until 42 weeks. If you go overdue, your baby is very heavy. Okay, and sitting in this position all the time on your pelvic floor muscle is going to get a beating. So you need to make sure you are exercising it. So if you are pregnant, pelvic floor exercise should be your main exercise. I can't stress it enough. It's so important that we are seeing lots of women coming back after they've had their babies, and they're coming back with issues like, I can't control my bladder, I'm peeing myself, I'm not feeling the urge to go when I drink lots of water, I'm having to wake up in the night to pee or have wet myself. My underwears are always wet. I'm having to wear pads all the time, and just not being able to do their usual life. They're not able to go about their business as usual. They're worried about where the toilets will be in case they need to go. They can't hold their bladder for long. Okay, there is so much issues with your bladder care and your pelvic floor muscle now people are experiencing. So if you are pregnant, I urge you to do your pelvic floor exercises. Okay, it is so important. Even if you're not going to do anything, make sure you're walking half an hour a day, but you're doing your pelvic floor muscle at least 3 times in a day. Pelvic floor muscle can be done when you're doing you're sitting at your desk, when you are doing your hair, when you are brushing your teeth, when you're cooking dinner. It doesn't need anything. You don't need equipment, you don't need time, it's absolutely invisible. Like I'm doing pelvic floor right now. Can you see anything? My arms are here, I'm just sitting, I'm talking, and I'm doing pelvic floor exercises. Okay? This exercise could save your bladder works. It can stop you from having incontinence, peeing yourself when you don't feel like it, not knowing when you need to pee, feeling like, you can't go out, you can't go swimming, you can't go out for dinner, you can't go anywhere that takes a long time because you need a toilet all the time. And is a quick fix, is an easy fixable problem. Any woman, pregnant or not, planning to get pregnant or not, you need to do your pelvic floor exercises because it can get weak just with time. With even some people that do a lot of exercise, weightlifting, you're putting a lot of pressure on your pelvic floor muscle as a woman. So with time, it can get weak. Okay, your pelvic floor muscle when you're not pregnant is like this, it's tight. Okay, when you become pregnant, it can get a little bit looser. Okay, maybe like that. All right. When you have a vaginal birth, your pelvic floor muscle relaxes in order for your baby to be born. When it's done, it comes back up. Now, if you're already starting when it's weak and now you're going to birth, it's going to get weaker. And without any exercises, you are going to have problems with incontinence. Okay, so whenever you drink a little bit of water, you need to go. So some people will stop themselves from drinking water because they're worried that they're going to need to go too often. This is a weak pelvic floor muscle problem. You just need to exercise and it will go. It will stop, it will get better, it will improve, and at least it's not going to get worse. Without doing any exercises, it's not going to get any better. It could get worse, and there is all of this that you can do. So why face that? Some people are so far gone that they're even embarrassed to go and seek their medical professional's advice, or they're worried about going to see the GP to say, I'm having this problem, what can I do? They feel also that because they've had children, it's part of the effects of having children. No, it's not. Okay? It's absolutely not part of having children for you to have a weak bladder and incontinence issues where you are passing urine on yourself. It's not at all. And what you need to do is just to exercise. If you don't know how to do pelvic floor muscle, I'm going to explain it right now in this live, and then I'm going to post this later on as a video so you can come back again and watch again if you need to get a refresher or a reminder. But it's very simple and very straightforward. As a woman, when you go to pass urine in a toilet, so you sit on a toilet, okay? Once you start to pee, don't finish peeing before you try to look at your pelvic floor muscle. As soon as you start to pee, clench, okay? Hold your urine back. Stop yourself from peeing. Okay, and try and hold it there for about 3 seconds. That is the pelvic floor muscle that you are going to be trying to exercise. If you cannot do it, if you cannot stop yourself, you need to practice more. Once you've done it once or twice and you felt that feeling of holding yourself in, okay, you don't have to do it again. Don't try and find it again while you're trying to pee. After that, remember that feeling of trying to just clench inside your vagina up and holding that clench. The most you want to do is try and suck it in, like I'm doing it now. You suck up your vagina, hold up, okay? And then you suck and you hold. Don't relax. And then you hold for at least 3 seconds, and then you relax. Then you suck it up again, and you hold another 3 seconds, and you let go. You suck it up again, hold, and you let go. Keep doing this up to 10 times. If you are able to suck it up and hold longer, you want to then hold for 10 seconds. If you can do 10 seconds, this is amazing. Hold for 10 seconds, you let go. Relax for about 2 seconds, suck it up again, and hold for another 10 seconds, and you let go. You relax for 2 seconds, suck it up again, hold for 10 seconds, and you let go. You're doing that 3 times. Okay. And you're going to try and do it in the morning, in the afternoon, and in the evening. People, once they've learned how to do pelvic floor exercises, they know it. It doesn't go away. It doesn't change. It's the same exercises that you're going to do every time. The problem becomes remembering to do it. Okay, so a lot of women that I see in my clinic, when I'm at work, they know how to do pelvic floor exercises. When I ask them, have you been doing your pelvic floor exercise? They're like, oh yeah, that pelvic floor, of course, yeah, I'm trying, but I just never remember to do it. This is the problem. So people forget that they need to do it. They know how to do it, but they forget to do it. So if you are aware of how to do your pelvic floor muscle, the best way to help you to be consistent in doing it is by you doing like associating it with something. So whether you are associating when you're brushing your teeth, then you do them. The 2 minutes that you brush your teeth in the morning, you are doing your pelvic floor exercises. Okay? You hold 3 seconds and you let go. Suck it up, hold 3 seconds and you let go. Suck it up, hold 3 seconds and you let go. So associate it with doing something, because when you do something repetitively, with time, they normally say it takes about 30 days to develop a new thing, okay? To develop for your mind, your subconscious mind to be trained to remember something. So the more you do it consecutively, as you go each day without a break, the more likely you are to incorporate it into the action that you'll be doing. So if you do it, let's say for 30 days, every day when you're brushing your teeth, your body is going to remember, your mind is going to remember that this is what you do when you're brushing your teeth. Your pelvic floor muscle has to be associated with something, especially when you're learning to do it, and especially when you're trying to stay consistent. Okay, it is so important for any woman who is a woman to try and strengthen your pelvic floor muscle. If you are not able to feel your muscle, this is a problem. Okay, if you're not able to feel it, is because it's very, very weak, and that you are maybe not doing it right, or you're not sucking it up right, and that's why you cannot feel it. So you really want to try and make sure that you find it first. And the easiest and quickest way to try and find it is to try it when you are passing urine. So when you are passing urine, to locate your pelvic floor muscle, as your urine is coming out, stop it midway, clench up and hold it. Okay, that's the pelvic floor muscle that you're trying to exercise. And you're going to try and hold it and see that you can feel it. Once you felt it, let go and finish passing urine. After that, don't do it again when you're passing urine. Okay, once you've done it once, twice, you've seen and you felt it, don't do it again when you're passing urine the next time. What you're going to do is to do it when you're not passing urine. So when you've sat back down, you're watching your telly, your favorite, show that you're watching on telly, maybe every time you see a commercial or an advert, you're going to try and do your pelvic floor muscle, okay, with your favorite show. If you're there watching a marathon on Netflix, every time the next series is about to start, you keep doing it until the intro is gone. If you're the one that skips the intro on the Netflix series, try not to skip the intro. As the intro is going, you're doing your pelvic floor exercises. Okay, this is a great way to remember to do it, and you get it in with no effort, with no time out, with not do anything that's going to affect your daily routine or anything like this. Just incorporate it in doing things. When you are doing your dinner, you can start to think, whenever I'm chopping the onions, I'm going to do pelvic floor exercises. So anytime you're doing dinner and you're chopping your onions, you're going to remember to do your pelvic floor exercises. It is going to be helping, and what you're going to do is try and make this muscle really, really tight. Okay, there is at the point where you feel like it's almost like your pelvic floor muscle is so weak that you need additional help. If you need help with pelvic floor muscle, you need to have a physiotherapy appointment. Okay, physios are going to be doing what they call residual test. What they will do is they'll get you into their clinic, they'll give you lots and lots of water to drink, and then they're going to tell you to pass urine. You're going to pass urine, they're going to measure how much urine you've passed, and then they're going to scan your bladder and see exactly how much is left inside your bladder. When you say to them, oh, I don't feel like passing anymore, or I feel like I have finished passing urine, they're going to see what's left, and if it's too much left back as your residual, they will know that you have an issue. Okay, they're going to be teaching you how to do pelvic floor exercises. They're going to tell you how to do it in different positions, lying down, sitting down. But this is when you have real problems. You're having issues where you're just passing urine all the time. You're not sensing the sensation of needing to pee. You are going, but you're not finishing. You're going every 5 minutes. You're going every 10 minutes. Even when you haven't drank a lot of water, you're feeling like you need to go again. This is a problem. Okay, your physiotherapists are going to work with you to establish exactly what your problem is and how best to help you. Okay, in some situations, very rare situations, that a problem is so bad that the only thing or the only way that they can fix it is through surgery. Okay, please don't wait until you get to that point. If you are a person and you're starting to realize that, you know what, hmm, for some time now, I'm not able to hold my bladder for that long. When the urge comes to pee, you'll normally be able to hold it until maybe you get home from wherever you are. Now you're in the same situation, you need to pee, you're not home yet, you're in the same place or from work, and now you have to think, oh, let me go into a restaurant on my way and pass urine. You're not making it till you get home. Because if you were to hold it until you get home, you'll pee yourself. This is a sign your bladder is becoming weak or your bladder is weak. Okay? Your pelvic floor muscle is weak. You need to exercise it. You need to hold it. You need to start exercising. You need to get incorporated into your lifestyle, and you need to be doing it all the time. You don't need to sign up with the gym. You don't need any equipments to do it. You don't need any time to do it. You could be doing it when you're sat on the bus. You could be doing it when you're sat in the car and you're in traffic. If you are driving, you're in traffic, you get to a red light, make that be the time that you do your pelvic floor exercises. Whenever you come to a red light, you do pelvic floor exercise. You're sitting down, you're sucking it up and holding, you're letting go. You're sucking up and holding, and you let go. When the light goes green, you carry on. You stop and you carry on driving. When you get to the next set of traffic lights, you're going to make it your thing that as soon as you get there, you're going to start doing your pelvic floor exercises. Okay? You're going to keep doing it until your red light goes into green, and then you're going to drive. Every time you go into another red light, you're going to do it again. Associate it with something. If it's you doing school runs, okay? When you finish and you come back to the car, you drop your kids to school, if you go into the bus or whatever, your train, however you're doing your journey, as soon as you sat down, you're going to start doing your pelvic floor exercises. You're going to keep doing it. And there are also apps you can download to help you, to remind you. It beeps. It reminds you how to do your pelvic floor exercises. Some people know it as Kegels, and you can type it into your app store and put in Kegel exercise app. There's loads of them. You can download it, and then it will beep and tell you it's time to do your pelvic floor exercises. This is so important, okay? Your pelvic floor exercise is so important, guys, that you are doing it. After you've had a baby, you may not be able to do your pelvic floor exercises straight away. That's understandable. It's absolutely fine. Wait to heal first. Wait for your blood, your pelvic floor and all of that area to heal. It could take a month, it could take 6 weeks, it could take longer. But once in a while, try and see if you can sense and feel your pelvic floor muscle. As soon as you start to feel it with no discomfort, you start getting back to doing your pelvic floor exercises again, because you want to try and make it as tight again as possible so you do not have any issues. Let's say, for example, you get pregnant, you have your baby, you don't do anything, you get pregnant again within 9 months or 6 months or whatever, to having a second baby, a third baby, a fourth baby. You've never exercised your pelvic floor pelvic floor muscle before. You are going to have incontinence. You're going to have issues with your bladder. You will end up getting to maybe about 4 months, 16 weeks of pregnancy, 20 weeks of pregnancy, and then you'll be telling your midwife, oh, I feel like I need to go toilet more often, or when I go toilet, I find I've already peed myself a little bit. It's not normal. It doesn't come with pregnancy. You should not be peeing yourself when you're pregnant. Okay, you should not be peeing yourself when you're laughing. You should not be peeing yourself when you're coughing. You should not be peeing yourself when you're running, when you're exercising. It's not a thing. It's not normal. You should not be wearing pads because you're worried you're going to pee yourself. You should not be wearing tenor lady to go out. You shouldn't be wearing maternity pads to sleep because you're worried that you're going to be peeing yourself in your bed. Okay, not because you've peed, but because your body is just releasing, urine, because you're not able to hold it, or you feel like as soon as you get the urge, you need to go right now. By the time you get there, you've peed yourself just because you had the urge. You need to exercise. Guys, you need to do your pelvic floor exercise, okay? It's not a prerequisite that as soon as you've got pregnant or after you've had a baby, you need to be peeing yourself. You need to be having an incontinence issue. You should be peeing it's not normal. It's absolutely not normal, okay? Some people, I've heard a woman that's told me, oh, I put off past having a baby because I know that when you get pregnant, you're going to have problems with your bladder. You're going to pee yourself when you're pregnant. And I was really surprised and shocked that she even had this belief. And she actually did go as far as saying, I'm putting off pregnancy because I'm worried about this. And when I asked, have you had any issue with your bladder when you were not pregnant? She said no. But she's heard from other people, or maybe somebody said, oh, as soon as I had my baby, I started having urine problems. So I had issues with holding my pee or my bladder. So now she's associated in her own head that if I become pregnant, I'm gonna have issues with my urine. So she didn't want to get pregnant. And now that she's pregnant is one of her biggest problems. But she didn't know how to fix it. She's never even heard of pelvic floor exercises, And I was saying to her, start doing your pelvic floor exercises. It was my first appointment with her. It was my first time seeing her. It wasn't her first appointment. But I said to her, now you've met me, I'm telling you, start doing your pelvic floor exercises. I taught her how to locate it and how to do the exercises. Okay. And now at least she's armed with the information of how to do it. So her fears has now been reduced. Okay. She knows, okay, it can happen, but I can do something about it. I can avoid it. And by doing pelvic floor exercise, a simple thing, I can avoid all of that. So there's nothing to worry about. There's no more stress of that. Do you know what I mean? So if you've never heard of pelvic floor exercises until this video, then please start doing it now. I'm going to go over again on how you can locate your pelvic floor exercises. So the next time you are passing urine, you sat down on the toilet, you're about to pass urine, the urge is there, you need to pee. As soon as your urine starts to come out, try and stop yourself midway, okay? Clench up and hold your urine back. Hold that hold for at least 3 seconds. When you let go, your urine should continue to come out. Sit on the toilet, start to pass urine, and then clench to stop yourself from passing urine. That's the muscle you want to try and exercise. That's your pelvic floor exercise muscle, okay? So hold it 3 seconds and then let go. Once you've located it, that's it. You don't need to do it again when you're passing urine. In fact, do not do your pelvic floor exercise when you're passing urine because that will cause urine infection. It's just for you to locate it, and you're doing it just the once. That's it. Once you've had that sensation, the next time you're doing your pelvic floor exercises, you should not be on the toilet. Is when you're off the toilet. Okay, you found it. Go back to your toilet, finish passing urine, wash your hands, go away, sit down, and start to hold it. Clench upwards, suck it up, hold the suction, and at least hold for 3 seconds. If you can hold longer, you can hold it, then hold it for 10 seconds. So there's 2 ways of doing it that I teach my patients, okay? You're going to suck it up, hold for 3 seconds. So this is you go suck it in, 1, 2, 3, let go. Suck it up, 1, 2, 3, let go. Suck it up, 1, 2, 3, let go. Okay? If you are good and you can hold it for longer than 3 seconds, great. I don't want you to just hold for 5 seconds. I want you to go as far as 10 seconds. You're going to suck it up, hold, and count 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Let go. Let go for about 2 seconds. You let go, 1, 2, suck it back up and count again. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and let go. Do it again, hold up and count again up to 10 seconds. You're going to do that 3 times. And you're going to do that morning, afternoon, and evening. If you can fit more in during your day, please do. You can never do too much. Okay? That's like when somebody's building their body, they're building pec, they're building muscles, and they'll say, oh, I've got too much muscle, so I'm going to stop exercising. They're not going to stop exercising. If anything, they'll change it up. So when you feel like, okay, I've done enough, or you feel like I can't do the whole 10 seconds still, do 5 seconds then drop it down and then do a little less. But your main ones, you're going to do 10 seconds and you're going to let go for 2 seconds, suck it back up, hold for 10 seconds, let go for 2 seconds, suck it back up, hold for 10 seconds, let go for 2 seconds, suck it back up, hold for 10 seconds, and then let go. That's your third one. Then you can leave it. In a few hours again, you can start again. The second way of doing it is if you suck it up and you hold for 3 seconds, let go. You don't need to break. Just suck it up again straight away. Do it for 3 seconds again and let go. You're going to keep doing that up to 10 times. Okay? If you're holding for just 3 seconds, you do it 10 times. If you're holding for 10 seconds, you do that 3 times. I hope that makes sense. Okay? If you're sucking it up and you're holding for 3 seconds, you do 10 times. If you're sucking up, holding for 10 seconds, you do that 3 times. Okay? And you're going to try and do it 3 times a day or more, but your minimum is 3 times a day. This is going to help you to get back that strength in your pelvic floor muscle so that you're able to hold your urine longer. You are not passing urine anytime you pass, you laugh, anytime you jump, anytime you're exercising, anytime that you do anything strenuous to your pelvic floor muscle, you will not pee yourself. Okay, because this is not normal. It's not because you've had a baby that you must pee yourself now. It's not because you've had a baby that you can no longer feel your pelvic floor muscle or your bladder. It's not because you've had a baby that you need to wear tenor lady. It's not normal. Okay, what you can do about it is to do your pelvic floor exercises. When you've been doing this for at least a good 3 months and you've been really consistent, if there is no difference in your works, go and see your GP. Let them refer you to physiotherapist and get them to check your bladder works. They need to check your bladder function. Your pelvic floor muscle is weak. You have done your exercises, it's not helping, or the problem is the same, the problem hasn't improved much. You need to go and see a physiotherapist. If you are pregnant for the first time, let this be your best exercise that you do. You don't need to go jogging and running. You don't need to lie down, no position. You don't need any equipment, but make sure you are doing your pelvic floor exercises. Okay, make sure that you're doing it associated with something, whether it's brushing your teeth, whether it's driving when you get your traffic lights, you're going to do them. Whether when you are eating breakfast, you're going to do them. Whether it's when you're brushing your hair, you're going to do them. When you're having lunch, when you're watching your favorite show, whenever the adverts come on, you're going to do them. Okay, or anytime you see an advert, you're going to do them. You can associate with that anytime you see something, you do it. Okay, you need to associate it with something just so that it becomes like a habit. And then before you know it, it becomes like part of you, that you do it anytime that thing is happening, anytime you're doing something like you've associated with your pelvic floor muscle exercises, you will do them. But it's very, very important, okay? Please make sure that you're doing your pelvic floor exercises, because it's not a thing for you to have just because you've had a baby or just because you're pregnant. It's not part of it. It can happen. It can be triggered because of pregnancy, but you can solve it. You can make your exercises really tight. You can make your exercises so well that even after you've had your baby, you never have to have any issues. You will never have any issues of having to run too quickly to the toilet, passing you when you laugh or when you jump, when you are doing any strenuous exercise that put pressure on your pelvic floor muscle, that you pee yourself. It's not a thing. It should not be happening. So if you are the person that's experiencing this, please, please, please start doing your exercises. And I'm sure, I can guarantee you, after just a month of you doing it, your problems would have halved. You will find and you will see your results very quickly, which will motivate you to do more. So pelvic floor exercises must be a thing that you are doing. You have to do it. Thank you so much for the like. You have to be doing. Okay, it should be part of you, just like when you're eating. It's the thing that you do, especially when you're pregnant. If you are pregnant, pelvic floor exercise should be part of you. You don't want to finish having your baby and then now you can't hold your bladder. You are passing you when you laugh. You're passing you when you jump. You're passing you when you're running. It shouldn't be a thing. Okay, pelvic floor exercises is not a prerequisite that because you've had a baby, you are going to have incontinence issues. You're going to have bladder issues. You can no longer hold your bladder. It's not the thing. Otherwise, all these women that are having babies should be walking around with panty liners on. It's not happening. It's a common thing, but it shouldn't be so common that, you think it's part of it. It's part of having a baby. It's not. So please, please, please do your pelvic floor exercises. Okay, I don't want this live to be too long. I'm going to be ending it very shortly. And I hope you've got the message. I hope you are understanding me of what I'm trying to tell you, what I'm trying to advise you on. But please make sure that you are doing your pelvic floor exercises. Okay, it needs to be happening. It needs to be a thing that you do. You need to be spreading the words to other pregnant women. You need to be spreading the word to people who've had a baby. If you have a friend that's telling you, oh, I can't jump. Oh, when I laugh, I pee myself. It's almost like a joke. When I laugh too much, I'll pee myself. Oh, I can't jump, I'll pee myself. This is not normal. Ladies, this is not normal. You need to be able to hold your bladder. You need to be able to just jump, laugh, run without peeing yourself. You need to be able to hold your bladder when you need to pee from work and you've left, and now you're thinking, oh, I'm going to get home and do it, but now you can't. You need to be able to do that. You shouldn't be going to the toilet and you're peeing even before you've thought of doing it. Okay, you should not be woken up in the night because you've wet yourself. Okay, it's not normal. It's not a thing because you've had a baby, because that's all people always associate it with. Because I've had babies, always because I'm pregnant, I'm peeing myself. It's because your pelvic floor muscle is weak. Okay, it's an exercise that you should have done because of the weight of your baby, but you didn't do it. So now you've missed the boat, and now you're having the consequences of not doing it. Okay, even if you have a cesarean section, you still need to do your exercises because the weight of your baby is going to take effect on your muscle. Okay, so even if you're planning for cesarean section, it's not the thing a reason to say, oh, I'm going to have a, which I hear a lot in my clinic. When I say to people, my women, when they come, I'm like, are you doing your pelvic floor exercise? They're like, oh no, I'm going to have a cesarean section, so I'm not too worried about that. And I'm just like shocked. I'm like, huh? What do you mean? Just because you're gonna have a cesarean section, you don't need to do your pelvic floor exercise, or you don't need to worry too much about it, or if you don't do it for a while, it's okay. No, 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 no. It's not okay. You are still gonna be able to have that issue. You have your first baby cesarean section, your second baby cesarean section, your third baby cesarean section. Out of all these pregnancies, you're gonna be pregnant for 9 months. Okay, your baby's gonna be very heavy from about 32 weeks up until 40 weeks. If you're not lucky and you go overdue, 42 weeks almost. Okay, your baby's gonna be very heavy and the whole weight is sitting on your pelvic floor muscle. If you're not exercising it, you are going to have problems. 1, 2, 3, 4 babies, you're gonna have issues, guaranteed. Okay, even if they're all cesarean sections. Without your pelvic floor muscle, you're gonna have weaker pelvic floor muscle. And therefore, you're gonna be coughing, pee. You laugh, pee. You run, pee. You jump, pee. You're exercising, pee. And if that continues, the muscle is just going to get weaker and weaker and weaker. And then before you know it, you're having to wear pads all the time. It becomes a thing that you do. Instead of a pad becoming a thing you do, let you doing exercises, your pelvic floor exercise, become a thing that you do. Because you can never do too much. Your muscle is just going to be tight. Okay? Your muscle is going to be tight. We do not recommend you holding your urine. Okay? I'm not saying that your pelvic muscle is going to be so tight that you don't need to pee. So whenever you need to pee, you're holding it. No. Because urine is a toxins that your body is trying to release. Okay? Don't hold it in. If you need to pee, go and pee. What I'm talking about here is the fact that if you need to pee, right, you get the urge to pee first, and then you're nowhere near a toilet, and you know, okay, I'm on my way home, I'm going to wait till I get home. With your weaker pelvic floor muscle, you're not able to do that. You must get off the bus, the train, you must use the toilet in the train if there is one. You must, it's almost like you're eager, you're itching that you need to pass urine right now or you're going to pee yourself. But yet the edge just came now. That is not normal. You need to exercise your pelvic floor muscle. Okay? If you go to the toilet and then you pass urine and then you get the sensation like you are finished urinating. Okay? But as soon as you go to get up, more pee comes. Okay? Your bladder releases more. And then you've now dropped urine on your toilet seat, in your underwear, on your clothes. Again, this is not normal. You need to do your pelvic floor muscle. Okay? Do your pelvic floor muscle exercises, and that problem will stop. You will see that it will start to reduce, then it will stop completely. Keep doing your pelvic floor exercises. If you are not able to feel it, you're not able to do it, you're having any issues in doing it, or you're doing it but you feel like it's not helping, and I mean you have seriously been doing it. Okay, you have got a routine going, you are doing it consistently, and you're doing it every time you're meant to do it. After 3 months, your problem is still the same, see your GP. Don't sit and wait. Go and see your GP, tell them the problems, keep a log on how or write it down, however you feel, any changes, anything at all. Keep a log from when you start doing your pelvic floor exercise religiously, okay? 3 months later, if it's not any improvement, it hasn't changed, it's not doing anything, go back and see your GP with your log and tell them exactly what you experienced. Let them know, and especially so that they will know what you're going through, they'll know how serious it is, so they can make a referral urgently. When you get to your physiotherapist, they're going to be asking you questions like, how do you feel the sensation of going? Do you feel emptied when you go? Are you drinking a lot of water? Do you feel like you're passing as much as you're drinking? And do you have any, are you passing urine on your own? They will ask you about pelvic floor exercises. Have you been doing them? How long have you been doing them? How long have you had this problem? What do you think has triggered this problem? Okay, don't just go and be like, oh, I'm not sure. I'm not sure when it started. I have been doing my pelvic floor. Sometimes I do it, sometimes I forget. I do it when I remember. Things like that is not going to help you. It's not going to help them in order for them to help you. So please make sure you're keeping a log if you're having any incontinence issues. Okay, pregnancy, childbirth is a causation. It can cause you to have a weak bladder. It can cause you for your pelvic floor to be weak. Okay, especially if you've had a very traumatic delivery where you've been in labor for a long time, you've had a catheter insertion for a long time, you've had an episiotomy, you've had a really big tear, maybe a 3rd degree, a 4th degree tear. Your pelvic floor has had a beat into it. Okay, it will have issues, but again, you're not going to be left. You're going to have a physiotherapy referral. They're going to be seeing you during your labor before you go home, and they will have an update. They will have an appointment for you to come and see them sometime afterwards, so they can keep in touch with you. They'll keep you going. They're going to have you in their clinics. They're going to be supporting you. So you are going to have the support you need. But this is where you've never had any issues regarding your delivery. You've gone home. Your baby's now maybe 2 years old. And now you're realizing that you can no longer hold your bladder. You have to go as soon as you feel the urge to go. You are peeing yourself when you laugh. You are peeing yourself when you cough. You are not able to hold it. You are just having an issue. There's a mess going on. You need to start doing your pelvic floor exercises. Okay? That's my message today in this life. Pelvic floor exercises should be part of your routine that you do. If you are a woman, you need to be doing that. Okay? And also, even with age, your pelvic floor muscle can become weak. Again, it's a muscle. Okay? The tone can become lax because of age. So if you're watching this video and you are in a, you got nothing to do with your childbearing, you finished having your children, you are an elderly in your, your late 60s, going to your, middle age of 60, 65, you are 50, 55, you're going through menopause, and you're starting to realize that, you know what, I'm starting to feel like I can't hold my bladder. I can't hold my urine. Whenever I feel they need to go, I need to go right now. Otherwise, I'll pee myself. You need to exercise your bladder, your pelvic floor muscle. Okay? You need to start exercising your pelvic floor muscle. Exercise, 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 and then exercise again. It doesn't cost a thing. I'm doing it right now. I'm doing right now pelvic floor exercise. If you don't know how to do it, you don't know how to locate it, I'm going to repeat it one more time before I end this live, okay? When you're passing urine the next time, stop halfway through your passing urine. Halfway through you, as the urine is coming out, clench your vaginal wall upwards and hold it. Try and hold it for 3 seconds and then let go. When you let go, your urine will continue to go. It will continue to flow. After you've done this and you've located your pelvic floor muscle, that's it. Don't do it again when you're passing urine again. When you go to sit down, you wash your hands, you come back, sit down and start sucking it up and holding it in. Okay? And I said there's 2 ways of doing it. Either you are sucking it up, holding for 3 seconds, and doing that 10 times, 3 times a day. Or the second way is you're going to suck it up, hold for 10 seconds, relax for 2 seconds, hold again, suck it up and hold again for another 10 seconds, relax for 2 seconds, suck it back up, hold for 10 seconds, and then relax. That's 3 times. You hold for 10 seconds. You do that 3 times, and you're going to do that 3 times a day. So either you're holding 3 seconds and then doing that 10 times, or you are holding 10 seconds and you're doing that 3 times. Okay? So you hold 10 seconds, you do that 3 times, that's 1. Hold 10 seconds, you release, that's 2. Hold 10 seconds, you do again, that's 3rd time, and that's your 1 done for the morning. Again, in the afternoon, you do exactly that. In the evening, you do exactly that. Try and associate it with doing something that you do often. So if you're brushing your teeth in the morning, you're doing your pelvic floor exercises the whole time. You're not counting, you're just doing as much as you can. The more you do it, the better. Okay? You're holding and then you're releasing. Holding and releasing. And then the next time you do it again, maybe when you're, eating lunch, you do it as you're eating and you let go. You do it when you're eating and you let go. And in the evening, when you're brushing your teeth before bed or brushing your hair before bed, you do it the whole time that you're doing that action before you go to bed, if that makes sense. I hope this live has been important and informative for you. And I will see you again in the next live. Have a lovely week, and I will see you again. Take care, guys. Bye.